All right, hey everybody, Dr. Hagmeyer here. Welcome to my YouTube channel. Today we're talking about iron deficiency anemia as being one of the most common mineral deficiencies that we see in people with low thyroid disease, hypothyroidism, as well as Hashimoto's. And this is especially important if you're a menstruating woman. So in today's video, I'm going to discuss why iron deficiency anemia is just so important to people who suffer with thyroid disease and Hashimoto's. I'll talk about how iron deficiency anemia influences mental health and neurotransmitter function, and why this is so important, especially when you're suffering with depression and insomnia and anxiety, which is also common in patients who struggle with Hashimoto's and hypothyroidism. I'll talk about the three main ways that iron deficiency anemia develops, some of the ways that we often tend to overlook. I'll talk about what testing and blood markers you should have done if you suspect iron deficiency anemia. And so let's unpack some of these things, jump into this, why they're important. So number one, if you're a woman suffering with fatigue and depression, restless leg syndrome, brain fog, I want your very next thought to be, did my doctor order a complete iron panel? And if not, well, then I'm actually very disappointed in that doctor. So what is iron deficiency anemia? Why is it important to test if you have fatigue and depression and brain fog and thyroid disease? Well, as the name implies, iron deficiency anemia is due to insufficient iron levels, right? Without having enough iron, several major things happen in our body. Number one is we can't produce enough red blood cells. Now that may not sound like a big deal, but without enough iron, your red blood cells can't carry oxygen to the tissues in your body. Number two, you won't be able to produce energy. So you experience things like fatigue and brain fog. You experience shortness of breath, even from walking up or walking down the stairs. In severe states, you begin to experience confusion, disorientation, obvious brain fog. You experience depression, anxiety. You see, iron is one of the key cofactors in actually making neurotransmitters, which are, of course, those chemicals made in the brain, like serotonin and norepinephrine, and especially dopamine. You see, dopamine plays a major role in focus and in concentration, and is really one of those feel-good neurotransmitters along with serotonin. But the importance of iron on mental health is so profound that I'm going to be doing a video that'll be coming out shortly that talks just about this. So what else do you need to know about the importance of iron? Well, without enough iron, when you get sick, it takes longer for you to bounce back from that sickness. You develop recurrent infections, maybe coughs and colds and flu-like symptoms that you just can't get rid of. Without enough iron, your brain, your brain obviously suffers, but your nails, your fingernails, your hair, they get brittle. You get headaches, you get mouth sores, believe it or not, and you can actually have low thyroid hormones. To help you see how this happens, I want you to look at this picture here. Notice that with anemia, what you're noticing is that the number of red blood cells are reduced. And like I said earlier, with reduced number of red blood cells, we have less oxygen circulating and being carried around in our body. Now that you're more familiar with the symptoms of iron deficiency anemia, let's talk about how you develop iron deficiency anemia. When someone develops iron deficiency anemia, it's not enough to take iron pills, all right? And at times, while taking iron pills is critical, correcting the cause of this iron deficiency anemia is really what the goal of care needs to be all about. And that's going to require a little bit of investigation. So in order to do that, let me give you three main reasons why we develop iron anemia, why it's so common in women with thyroid disease and Hashimoto's. Well, number one is due to blood loss from the gastrointestinal tract. You know, this blood loss could be coming from the upper GI tract, or it could be coming from the lower GI tract. In some cases, your doctor may order a stool test to check for blood coming from your lower GI tract. And this can be caused by things like inflammatory bowel disease, right? Things like Crohn's disease or ulcerative colitis, which we know are very common in people who suffer with thyroid problems. It can also be something like internal hemorrhoids, right? So if you're having symptoms like acid reflux or burping and belching and bloating and gas, and you have pain in the upper right-hand corner of your stomach, right? This could be due to an H. pylori infection, which is a bacteria in the stomach that causes some of these symptoms. But because H. pylori burrows itself into the lining of the stomach, it can actually cause intestinal bleeding as well, or stomach bleeding. So your doctor may need to order some specialized tests for this, one of them being what's called an endoscopy or an EGD. These tests can identify problems in the upper part of your GI tract, such as the esophagus as well as the stomach, right? Now, another common cause of iron deficiency anemia is due to blood loss, which deals with potentially an abnormal menstrual cycle. So if you're a woman that has endometriosis or fibroids or some other kind of female hormone problem that causes heavy bleeding, or your cycle is shorter than 28 days where you bleed more frequently, these problems will also lead to iron deficiency. So outside of iron deficiency anemia being caused by blood loss, another potential cause for iron deficiency anemia after bleeding is due to malabsorption, right? Malabsorption often occurs when the contents of the stomach tips towards alkalinity rather than acidity. See, your stomach by design has to be acidic in order for you to break down proteins and break down fats and absorb vitamins and minerals. And specifically, the vitamin and mineral that we're talking about today, or the mineral that we're talking about today, is of course iron, right? You need to have an acidic stomach in order to absorb iron. So any change to the pH of the stomach away from acidity towards alkalinity will cause malabsorption of these minerals. Things like celiac disease, SIBO, small intestinal bacterial overgrowth, leaky gut, infections with H. pylori, infections with Giardia, which is a parasite picked up in the water supply, certain medications, antacids, birth control pills. These are just a few of the potential causes that lead to malabsorption-induced iron anemia. Now, a third common category for an iron deficiency anemia after blood loss and after malabsorption is going to be related to diet, right? So if you don't eat red meat for whatever reason, whether it's a religious reason or maybe you're a vegan or a vegetarian, or because you've eliminated red meat because you heard that eating red meat is bad, whatever that reason may be, then it's also a very possible cause of iron deficiency anemia caused by diet or induced by diet. Now, with that being said, I want you to realize that not all iron is created equal. Just because you eat a diet high in vegetables, that does not mean that you're not at risk for iron deficiency anemia. And here's why. The iron that's found in red meat is called heme iron, right? H-E-M-E, heme iron. And the iron found in vegetables, especially the green leafy vegetables, is non-heme iron. Well, the reason why non-red meat eaters, okay, are more prone to deficiency anemia or iron deficiency anemia is because the iron found in red meat, or heme iron, is better absorbed than the iron that's found in vegetables, green leafy vegetables, or non-heme iron. Also, if your diet is high in phytates and high in lectins, which many vegetarian diets are, these chemicals can block and bind up the absorption of iron and block the uptake of that iron into the gut. And so no amount of soaking your lentils, your beans, your nuts, and your seeds will get rid of this. All right, so that's very important because a lot of vegetarians tend to think that, oh, I'll just soak my beans, soak my nuts, soak my seeds, and that will help minimize the level of lectins in it. Okay, and that's not the case. All right, so let's jump into what iron deficiency means to a person with thyroid disease or someone with an autoimmune thyroid disorder like Hashimoto disease. Right? But let's talk about the blood markers that make up a complete iron panel so you understand those a little bit better. And then, of course, one thing to always understand is that with any chronic metabolic disease, there are numerous minerals and vitamins important for normal function. I've done lots of videos on those. But when it comes to thyroid disease, it's no different, right? Certain vitamins and minerals can be a real deal breaker when it comes to how that gland will work when faced with a vitamin or mineral deficiency. Vitamin A, iodine, selenium are three of the more well-known vitamins and minerals involved in the formation of thyroid hormones. But an iron deficiency anemia impairs thyroid hormone production by reducing something called thyroid peroxidase activity, right? If you're a person with Hashimoto's disease, this is a test, antibodies against this enzyme is a test that's often done to diagnose Hashimoto's disease. But the important thing to understand is that iron deficiency impairs thyroid peroxidase activity. So again, when we talk about thyroid levels, things like TSH and T3 and T4 levels, thyroid peroxidase is one of the main players here. You see, thyroid peroxidase is the enzyme that plays a role in thyroid hormone production, right? So you can't make T3 and T4 without thyroid peroxidase enzymes. And in order to do that, you need iron, right? Incidentally, there is this enzyme this is the enzyme, I should say, and I mentioned this just a moment ago, but it's worth repeating here again. This is the enzyme that is attacked or destroyed in Hashimoto's disease. So again, Hashimoto's attacks TPO enzymes, right? In case you're wondering about that. Now, this is also the reason why every person with thyroid disease, right, should have thyroid antibodies evaluated. Hashimoto's disease is the #1 cause of low thyroid disease in the United States. So if your doctor hasn't run those antibodies, I highly, highly suggest that no matter what, you get those antibody levels tested. Right? Now, the next thing that I want you to see here is if the immune system is attacking this enzyme, causing low thyroid hormone levels. When studies have been done looking at the role that iron plays, studies show that patients who have low iron, right, even a moderate degree of iron deficiency, that iron deficiency significantly lowers both T3, T4, and reduces TSH levels responsiveness. What that means is that your thyroid is not going to be as responsive to that TSH signal, and consequently your T3 and T4 levels most likely will be low. Right? Now again, this can be a double whammy for the person who already has Hashimoto's disease, and here's why. All right? Remember what we said just a moment ago. We said that in Hashimoto's disease, the immune system is attacking and destroying that enzyme called TPO. It's not uncommon to see low thyroid levels when the immune system has turned on the thyroid gland. And while the immune system might be the primary reason for the low thyroid levels, those low T3 or low T4 levels, having low iron further suppresses the TSH, further suppresses those T3 and T4 levels. And that's the icing on the cake for someone who already has low thyroid levels or has that Hashimoto's disease. All right. So far we've talked about the symptoms that low iron has on the body. We talked about some of the reasons behind why an iron deficiency develops: anemia, blood loss, malabsorption, diet related. We talked about iron deficiency can affect TSH levels and T3 and T4 levels, why it's important for thyroid peroxidase production. The last thing I want to talk about and go over with you are some of the markers that make up a complete iron panel or comprehensive iron panel. Why you should have that done if what I'm talking about resonates with you. And if you've recently had blood work, now's a good time to actually pause this video, pull out your blood work, and as we go through this, it'll just make more sense to you, right? So the first marker that you want to look at when you look at your blood work is your red blood cells or your RBCs, your hemoglobin, and your hematocrit. Now, these are part of a very standard panel of blood work called your CBC, your complete blood count. Again, very, very basic blood work here. What you'll find in the case of iron anemia is that these will either be flagged as being low on the reference range or they will be low normal, right? Now, for those of you who don't look at blood work every day, low normal is essentially where the marker didn't get flagged as being low, but when you look at the reference range, those levels are low. Again, so that low normal, for those of you who don't read blood work every day, is the marker didn't get flagged, but again, when you look at the overall reference range, it's on the bottom end of that, right? Okay, that's called low normal. The next marker that you want to look at is what's called your total iron, right? This is another very, very important measurement here. A lot of doctors use this as the sole indicator for determining whether or not a person should be taking iron, and that's not really a good idea, right? So this total iron, this is the measure or the amount of iron in the blood, right? The average reference range for this goes from 45 to 160. But the range that I prefer to use is anywhere between 85 to 130, right? This is where healthy people have their iron levels, between 85 and 130. The next marker is ferritin. And chances are your doctor did not run this test, yet this is one of the most important markers that indicates whether or not you should be taking iron supplementation. It's also a marker that should be tested periodically, every few months, in order to see whether or not your iron levels are coming back to the normal range, or your bank account of iron levels are coming back up to the normal range, and when you should stop supplementing with iron pills. All right, so the next thing we want to look at is this. If the total iron or the amount of iron available in your blood is ferritin, is like your bank account, it's the reservoir of iron. And when this gets low, this is when you really get into trouble. So that's why it's so important to always look at the iron ferritin levels. Now, lab report levels will show that anywhere from 10, I believe it's all the way up to to 230 or so is considered a normal level. But what I would like to tell you is that we want to optimally see these ferritin levels at around 100. right? So that's very important. If you're writing that down, ferritin levels of around 100. I've seen ferritin levels as low as 5 and as low as 10, and this again is where you really begin to struggle with these signs of iron deficiency. You really have bad fatigue, shortness of breath, brain fog, you're depressed, you're anxious, you can't sleep, restless leg, and so on. So this might be one of the reasons why your thyroid hormone levels continue to be low as well. Again, I can't begin to tell you how many times I've worked with patients where low iron and ferritin levels was missed by the patient's primary care doctor. And yet once we corrected, the patient felt amazing. So again, don't overlook the importance or the power and the influence that iron can have and ferritin can have on your overall health and well-being. Okay, so another marker that is not often run unless your doctor has ordered a more comprehensive iron panel is the iron saturation. Right? Now, iron saturation or percentage saturation, depending on the lab, they may refer to it as iron saturation. Some may refer to it as percentage saturation. But either way, this marker tells us how much iron is actually bound to a protein called transferrin. Now, I want you to think of transferrin, if you've had this marker done, this is like a ferry boat, right? It takes iron all around the body. If transferrin is like a ferry, iron saturation is like the number of people riding on the boat, riding on that ferry. For example, let's say you've had this marker done and you're looking at your blood work right now and it says that your iron saturation says 30%. Well, what that means is that 30% of the iron binding sites or transferrin are being occupied by iron, right? So if you look at your iron saturation and your percentage saturation and it's less than 30%, that's on the low end. I like to see these values anywhere between 30 to 35, all right? The last marker important in understanding iron deficiency anemia is your total iron binding capacity. Now, when we talk about iron, iron moves through the blood. It's attached to transferrin. Total iron binding capacity measures how well transferrin can carry that iron in the blood. So the thing to understand about this is that when you have high total iron binding capacity level, so you have a high TIBC, this is an early warning sign indicating that your iron levels are getting low. The lab reference range for this one goes anywhere from 250 to 450, but I would tell you that anything over 350, I start thinking about early iron deficiency. So don't wait for that number to get over 450 if all your other levels are normal, right? Talk to your doctor about iron deficiency in the presence of all these things, because all these markers really need to be looked at together when determining whether or not iron supplementation is a good idea. All right, so that's going to wrap up today's video on iron deficiency anemia and its role in hypothyroidism. I have a few closing points that I want you just to remember. All right, so number one is if you found this video helpful, share it with other people who are struggling with symptoms, especially if they have thyroid disease. Number two, when you're dealing with anemia, it's not just a matter of taking iron pills. All right, while taking iron pills is an absolute necessity, when your iron levels and ferritin levels are low, don't forget about getting to the root cause of the iron deficiency anemia while you take those iron pills, right? Number three, a problem that I see from time to time is a person who thinks they need to supplement with iron because they can identify with many of those symptoms that we talked about. And so they start supplementing with iron pills. Well, if you take iron pills and you don't need them, you can cause something known as oxidative stress, which causes a lot of damage to your body. So be sure before you start taking iron that you get these levels tested. Number four, the root cause of iron deficiency could be tied into your gut, could be tied into your diet, could be tied into certain medications, could be tied into malabsorption, heavy bleeding, disorders such as ulcers, H. pylori, abnormal menstrual cycles, right? And a lot of other things that need to be considered as the cause or the root cause of why you have iron deficiency anemia in the first place. All right, so there you go. If you need help understanding your blood work or interpreting your blood work, or you just need a second opinion as to why you might have an iron deficiency anemia, what I will do is I will leave a link in the description that'll take you to a page on my website and show you how you can submit your blood work for my review. Also, if you haven't had these markers done and you need help ordering a complete or comprehensive iron panel, because let's just say perhaps your doctor just doesn't feel that they're necessary and they just want to put you on iron supplementation, but you're concerned about taking iron in light of having all these markers done, we can help you with that as well. All right, so till next time, I'm Dr. Hagmeyer, and we'll see you in the next YouTube video. Take care.